Good evening. We have a record of starting on time, and we didn't want to deviate too much today. So welcome to this program on Healers or Predators, Healthcare Corruption in India, organized by the Hindu Center for Politics and Public Policy. We are waiting for one of our main speakers. His flight was delayed, a flight from Delhi, but he's very close by and should be here any minute. Dr. Shamiran Nandi. We have this panel discussion addresses a subject and a set of general as well as specific issues that are of critical importance. They are of vital importance to the people of our country and to India as a society, as a political economy, and as a self-proclaimed welfare state whose constitution makes the improvement of public health, among other goals, quote, a primary duty of the state. I repeat, the improvement of public health is a primary duty of the state. This discussion, organized by our center, arises out of the work done by more than 50 contributors to this well-researched, splendid, if depressing book, to quote from Amartya Sen's foreword. It was published recently by Oxford University Press, New Delhi. It's an authoritative and revealing collection of 41 essays or chapters drawing from research as well as reflection based on practice. There's a very helpful introduction by the three editors of this work of many hands. The book is organized into 8 sections by broad themes. 1, background. 2, corruption in practice. 3, morals, politics, legal issues and consequences. 4, we are not alone. They comprise 4 chapters: global medical corruption and healthcare corruption in Bangladesh, Sri Lanka and Pakistan. Just somewhat comforting, I suppose. 5, governance and healthcare corruption. 6, personal views. 7, major scandals. And 8, beacons of hope. And there's a very short conclusion offered by the 3 editors of the book. Now, the contributors include a substantial number of medical practitioners, including distinguished physicians and surgeons who are represented here, teachers and researchers, including journalists. The main title, Healers or Predators, captures the heart of the book. The secondary title, Healthcare Corruption in India, suggests a large part of the diagnosis, and when you finish the book, all its 657 pages, you will find the rhetorical question fully vindicated. Amartya Sen states in his foreword that, quote, the lack of public discussion and exposure of the nature and extent of the debasement of healthcare corruption, Indian healthcare, is a major cause of the persistence of the terrible deficiencies. I agree with him that healers or predators will significantly help to remedy this deadly neglect, although some of our panelists may have questions about that. Our panel comprises 4 distinguished contributors to the book. Each one of them can speak from decades of experience in the field. They are Dr. Shamiran Nandi, Emeritus Consultant, Sir Gangaram Hospital, New Delhi, a well-known and well-published surgeon who's awaited, he should be here any minute. Keshav Desiraju, former Union Health Secretary. Dr. M.K. Mani, a pioneer in the study and treatment of diseases of the kidney. And Dr. George Thomas, an orthopedic surgeon who worked for 25 years in the Indian Railways and now works at St. Isabel's, Chennai. The first 2, that is, there he is. Welcome, Dr. Nandi. No, you are on time. Consider. Please come up. I was providing some background which you can read, so I won't repeat it. Dr. Nandi and Mr. Desiraju are editors, are two of the 3 editors of this book. The other editor being Dr. Sanjay Nagral, who was invited but couldn't make it to this event. Dr. Mani has contributed a chapter titled Corruption in Everyday Medical Practice, and Dr. Thomas a chapter titled The Consequences of Corruption in Healthcare. The organization of this discussion will be as follows. Each panelist will make opening remarks for about 8 minutes. I was going to say 7, but after a mild protest, we've added 1 minute, 8 minutes each opening remarks. That will be followed by my moderator's questions to them. And finally, the panelists will take questions from the audience and may also make brief concluding remarks. And we hope to conclude by 8 p.m., although we are slightly flexible. We have this hall for a little longer. Now I'll just have a brief word with Mr. Desiraju to see whether he or Dr. Nandi will open this discussion. You're ready? Yeah. He's eager to open the innings.
I'm very pleased to see so many people here looking and listening about healthcare corruption. I must say it's a subject which is quite close to me because I am probably part of a long-lost generation of Indians who were born into privileged families and who had education in the best schools and the best universities in the world. But we had, because I think of Nehru, a very strong patriotic zeal to come back and help India become a great nation. And so after many years in England and America, I tried to get a job in India. And the chairman of surgery at the All India Institute came and he was feted regally and he said that he'd give me a job. Needless to say, there was no job. The second time, there was an advertisement. And my wife, who was doing a PhD on an important subject like, the change of family structure in West Bengal at the turn of the century. And she saw an advertisement and she told me, and I was at Massachusetts General Hospital, Harvard Medical School to apply. I applied. When I came, I realized I came to see what India was like, in fact. And I stayed with a friend of mine who was press secretary to Mrs. Indira Gandhi. And he said, have you come for the interview? I hadn't got the message to come. And when I came down the next morning, he said the interview's the next day, and he was ringing up every single person on the selection committee. And he said, a friend of mine has applied for this job, and I'm press secretary to Mrs. Indira Gandhi, and I would be grateful to see that justice is done to him. So I duly got the job. I said, I don't want the job under these circumstances. He said, you'll never get the job unless you have to accept this. So I started on the wrong foot. I joined the All India Institute as an assistant professor. My wife was a very strong patriotic person, and we got 900 rupees a month. We stayed in a very small flat of 700 square feet with an Indian-style lavatory, which took 3 months to change because of bureaucracy. But I loved the job. It was very interesting. The patients were poor, very interesting problems they had, and they were inordinately grateful for little things you did for them. There was, of course, a background of corruption. The corruption was manifest as doctors running after politicians, going to their houses, and one person who was on the selection committee told me, who's my patient, that 70% of the faculty used to come to his house to ask him for favors, canvassing for promotion. And really, I thought, well, this is India, I like the job, and I don't want to give up. And needless to say, I didn't get promoted anyway. I stuck at assistant professor for 12 years. What really changed? Gradually, I crept up the ladder, and I really loved the work in the All India Institute. But what brought light into my life was an article by Dr. David Berger, who worked in the Himalayas in Landau, and he said that corruption pervades Indian healthcare. He said that while he was writing a prescription for an ECG, a junior doctor said, "I'll do it." Why? Because he will get a kickback from the ECG person. And he said that this is a terrible thing and something should be done about it. And I think that I wrote an editorial in our journal called Current Medicine Research and Practice. This was taken up by the British Medical Journal. And Dr. Kamran Abbasi, who was the deputy editor of the British Medical Journal, Anita Jain from Bombay, and I wrote an editorial about corruption in Indian healthcare. This was taken up by all the newspapers, and the health minister said, it is true that there's corruption in Indian healthcare. The MCI is a den of vipers. We should get rid of it. And now the whole thing has snowballed into a big issue. Oxford University Press then said, why don't you edit a book on corruption? And since I didn't know enough about healthcare, I asked my friend Keshav Desiraju, who had been an outstanding health secretary and a straightforward health secretary, to join, and Sanjay Nagral from Bombay. And we asked a large number of people, and I don't think anyone refused. We wanted to put corruption in healthcare in a kind of academic background, as well as have personal stories. And in the end, we said that we should not end by being pessimistic. We should also highlight what has been great in this country. And I think that there are many institutions like the Banyan, Christian Medical College, Vellore, the Wardha, all these places have been outstanding beacons of hope. And not only that, I think that in the middle of healthcare corruption, we have produced some great doctors. Of course, there have been other people will say differently, but I think in my experience, the great people I remember are Dr. A.K. Basu of Calcutta, Dr. N.H. Anthya of Mumbai, and of course, Dr. P.K. Sethi of Jaipur, of the Jaipur Foot. I am really very pleased and grateful to the Hindu and Mr. Ram for hosting this occasion, because I think that the Hindu is one of the only newspaper in India that I admire, and I read nearly from cover to cover every day. Thank you very much for coming.
Thank you, Dr. Nandi. And may I now...
Thank you, Mr. Raman. Thank you, everyone, for coming to this evening's function. I'd just like to say a little bit about the context. Dr. Nandi has explained that the idea for this book really came from a lived experience of corruption, as it were, at various levels. But there are a couple of points which I would just like to flag. Now, our book is called Healers or Predators, and it somehow gives the impression that it is only doctors who are responsible for corruption. Now, this is not at all the case. The fact is that the public health ecosystem, as it were, doctors do make up a very, very important and essential component of that. But it also includes health policymakers. It includes regulators such as the Drug Controller General of India or the Medical Council of India, the Nursing Council of India. It includes a range of miscellaneous service providers without whom the health system itself would not function. And very importantly, it also includes the public in the sense that these are the public in the sense that this is screaming at me if I go any closer to it. The public in the sense that it is their expectations of a public health system that is very important. What is it that people want? And is our system delivering what people want? So I would not like this impression to stay that it is actually that the whole problem is with doctors and settle the problem of corruption in the doctor establishment and you've done what needs to be done. Not at all. Health regulation and health policy making are also very crucial, and it is corruption in those sectors. And we do the discussion on Vyapam, for instance, is a very fine example, a detailing of what happens when the entire system from within begins to rot. Several pieces pick up on the Medical Council and what the Medical Council has not done. And as all of you would know, there has been a very recent development in the history of the Medical Council because yet again it has been suspended. And we now have to wait and watch to see where this suspension is going to lead. So that is one set of issues. The other point to flag is, and this point has come up in earlier discussions around this book, that well, why are you only talking to doctors? I mean, it's not as though we're the only people in India who are corrupt. This is, of course, true. If you begin to go into the area of higher education, if you go into school education, if any sector you go into, you will find any area where there is government expenditure, you will find instances of reckless corruption even. So we are not at all making the case that the medical sector, the healthcare sector is somehow uniquely susceptible to corruption. Not at all, but it's a sector that between us we felt we knew a little about and could therefore address more comprehensively. The third set of issues which I do believe we should talk about, which I think the book pushes us towards, is so what happens? Because many of the pieces in this book, people speak from experience. People have been actually extremely forthright, even courageous in actually saying what happens and the kind of experiences they've been through and the way in which corruption in real life takes place in this sector. So the question is, well, where do we go? We can't just keep bemoaning the fact that there is widespread corruption. Where and how is this corruption to be stemmed? And this is where I do believe health policymakers need to actually think about it. We hear a great deal these days from health policymakers about Ayushman Bharat. Now, I have no problems with Ayushman Bharat. It's a fairly well conceived program, but there are a very large number of unanswered questions. And the way in which it has been structured, Ayushman Bharat that is, does nothing towards addressing the specific points at which corruption has been known to occur. We have basically, we still have a system where everything depends on a limited number of people providing a scarce resource, which is healthcare. All the corruption that we see in healthcare comes from the fact that a limited number of people need to provide an essential service to a very vast population. And as long as this imbalance continues, that situation will continue the corruption situation will continue, And Ayushman Bharat, I fear, the way it is currently structured, does nothing to redress the imbalance between a limited number of providers and the very large number of people who may need the service that they are providing. And absolutely one last point I want to make, which is again that in discussing the question of healthcare corruption, we have to face, the one big question we have to address is corruption more in the private healthcare sector or in the public healthcare sector? There is no dispute that corruption exists in both sectors. But where is it more and where is it more likely to be damaging? It's a question, there's no easy answer to this one. We are all familiar with instances in both the private and the public sector in healthcare. And I think this question is going to be with us for some time. We need to find ways that address, because there are different factors that cause the corruption in the public and the private sectors, and how best do we go about addressing those? Thank you.
Thank you. Thank you very much. I now request Dr. Mani. He has a contribution in the book, a chapter called Corruption and Everyday Medical Practice. And I think he will speak to that chapter and what he's observed.
Actually, Ram, I don't mean to speak to that chapter. I think there are many other things I would like to speak about. I have perhaps a position of vantage over here because at a glance, I think I am the second oldest person in the room. I'm aware of one person who is older than I am. And what I would like to say is that none of you could have reached your present age without having come into contact with the medical profession in some way or the other. So what we're mentioning in this book is something that you would have come across anyhow. You would have met it somewhere or the other. It's only put together and documented over here for you. A couple of points that we should establish. It's not our idea that we should give you the impression that except for the contributors to this book, all the other doctors in the country are corrupt. That's not true. There are a large number of people who are doing an excellent job and working extremely hard on that. The second point I'd like to say is, which has already been mentioned, is corruption does not exist only on our side. A significant amount of the corruption comes from you. And I find that many people are quite ready to go on and criticize the medical profession, but they want certificates, which may not be entirely true. And they want insurance, which very often, most people in this country fall ill, get an illness which requires a lot of expenditure, then bluff the date on which they got the illness. They take an insurance policy, they come to the doctor and say, now I got it from so many years ago, but on your notes, please make sure that I got it only 2 months ago. And that's a very common thing. I can tell you as a practicing doctor, it is routinely done. How are we going to rectify this? That is the major problem. It's easy to point out the defects. I don't know how we're going to rectify it, and I'm rather pessimistic about all that we would like to do. Obviously, you need a strong and straight regulator. The Medical Council of India, which was supposed to look after all that, is actually a cesspool. And I don't know what is going to come of the desire to, or the intentions talked about of reforming all that. Basically, we are not a people who respect rules or laws. You just have to think of all the posters, the placards, which we have on the pavements the last 2 days. There are rules which say you should not do it. But what's the rule for? Just go down the road and see how many of the motorcyclists are wearing helmets. Most of them, I see, today I saw quite a few people who have a helmet, but it is on the petrol tank. So I presume the petrol tank of the motorbike will be well protected and is not going to have any problems. I thought that the way that we should make a beginning is that we have to look after healthcare for the poor. The rich somehow or the other will manage, and they may be able to also take remedial action if they find somebody who is very corrupt dealing with them. We must strengthen the public hospitals. When I was a student, and I admit that that was prehistoric days, many of you may not be aware of those. In those days, the place to go when you were seriously ill was the government hospital. You may go to a nursing home to have minor surgery under comfortable conditions, but if you had something seriously wrong, you went to the government hospital. Government has abdicated its responsibility to maintain a center of excellence for looking after the care of people. Maybe the All India Institute is an exception. It is widely regarded as one of the best hospitals in the country. But I can tell you definitely that at least as far as this state is concerned, the government hospitals are no longer the leaders. I don't find any sense in these government insurance schemes, which are very good vote-catching schemes. Andhra Pradesh started it. All the southern states have taken it up. Now the central government has also taken it up. So what are we going to do? Spend government money, which will go to the private sector. The private sector has enough money on its own. There is no necessity for government money to be spent going to the private sector. I don't understand why the money that government spends on the insurance cannot just be spent on improving the facilities in the government hospitals. Don't have this kind of an insurance system at all. In my days, people with an income below a certain level were treated free at the government hospital. If their income was a little higher, they were charged a little bit, not too much. If you were really wealthy, you went to the upper class wards and you paid a lot for the treatment over there. What I feel is that the only way we can improve the government hospitals is if we insist that all those who get paid by government for their health care should get that health care at the government hospital and nowhere else. Everybody has a right. Everyone has a right to go to the doctor whom he chooses and to go to the hospital that he chooses. But he should pay for it. If he goes, and this I apply particularly to the senior government officers and the ministers, why should they get government money being spent at a private hospital for their care? Years ago, I had a fairly famous government person who consulted me, and the first thing I asked him is, why are you coming to me? I'm at a private hospital. You run a hospital yourself. Why don't you go to that hospital? And he told me, so I said, why is that not good? You're running it, make it good, and the only way that it'll get good is if you people all go there. You all go to the private sector, you don't bother about what is happening in the government hospital. When I was a junior doctor, Bhaktavasalam had a fracture. He came to the government hospital. Bhaktavasalam was Chief Minister of Tamil Nadu at that time. He had a fracture. He came to the government hospital. We had a lift which had not worked for 1 year, and he got admitted in a ward, which meant that the convenient way of going up was taking that lift. Overnight, that lift worked. This is what will happen if all ministers and all government servants go only to the government hospitals for treatment. And that is what I think we should try to insist on. I don't see how we are going to get people to do that. It's a very ambitious idea. But somehow or the other, if we can exert pressure to see that at least for that government hospital should come up, people, and the only way that it will come is if we can make sure that if these people go to any place other than the government hospital, they should pay for it themselves. And that is the way that I think hospitals will improve. The only way we can get it is by public pressure. All of you should exert that pressure on your leaders and your rulers to see that this is the thing that they should do. The government hospital must improve, and it can improve only if they go there and see what is actually happening over there, not just go on an inspection. When I was an assistant physician, we used to be told we had 18 beds in the ward, 50 odd patients lying on the floor. And we used to be told, health minister is inspecting tomorrow, discharge all the patients. So when the health minister came, he saw a clean hospital, 18 beds, 1 or 2 of them empty, all the doctors comfortably. He didn't see us crawling under the bed to find a patient, to examine him, to administer a drip to him while he's on the floor. They're never seen by the ministers. So this is what we should make sure of. The minister himself gets admitted there. He will know what is actually going on. Thank you.
May I now invite Dr. Thomas to speak his opening remarks. He has a chapter called The Consequences of Corruption in Healthcare.
In a way, I represent R.K. Lakshman's common man, because when I was still a student, Dr. Samiran Nandi and Dr. M.K. Mani were already famous. So I actually met Dr. Samiran Nandi in All India Institute when I was a postgraduate student in Trivandrum Medical College. When this topic of today's meeting has, it's been sent around on WhatsApp group, and one common response among doctors is that we should go there and, or rather, we should boycott this meeting. We should not have anything to do with this. And I'm sure a lot of doctors are going to ask me, why are you here? Okay, because this posed in this binary fashion. Either you're a healer or you're a predator. You can either be one or you can be the other. And they will say that people like Dr. Samiran Nandi, he has pedigree. What difficulty for him to be a healer? What about a person like you, who studied in a government medical college, came from a very reasonably okay family, didn't have a lot of what they call in Tamil Nadu background? What are you doing in this company? They are talking hot air. They don't know what the struggles of doctors are. And how can they call us predators? This is a common question that all doctors who hear this topic ask. And I was rather sad. I didn't know the title of this book before I contributed to it. Otherwise, I would have objected to this title. Okay, because there is a huge gray area between healer and predator. Lots of doctors may not be healers, but not all of them are predators. In fact, as many of them have very gently remarked, and I'm putting it very vehemently, most doctors are not predators. Okay, we have to think about, but are a lot of doctors corrupt? The answer is yes. And is there the only corruption, money corruption? Is only finance corruption? I would beg to differ. There are all kinds of corruption. There is corruption for fame. There is corruption for wanting to be up on the stage, speaking with Dr. Samiran Nandi. There is a corruption of wanting to be selected in All India Institute without paying money for it. There is all kinds of corruption. And they will say, they can easily speak. They never had to struggle for anything. We had to struggle. So we have to understand the ecosystem of corruption. When doctors ask, some of them ask me, doctors are not a happy lot. You go to any conference, they always complaining. And ordinary people wonder, what have they got to complain about? They have a wonderful life. But it's not really so. It's because they also have this pain in their heart that they are not doing what they set out to do when they became students. And that's because most of the students who were with me left the country. When we were young, we started a group called Medical Action Forum, which was for medical ethics. We were only in the 20s then. One of them, only surviving member of the group other than me is Dr. Amalur Pavanathan, who's sitting there in the second row. All the rest have emigrated. They're either in the US or the UK because they found it much easier to be ethical there than in India. But we struggled on and somehow managed. So the question is, what is it that removes this fair amount of desire to be of use to the society when they are students, and it changes when you come out of the college? If you study in a normal college, not in the All India Institute. All India Institute, 70% they export them. They go some other country. They don't stay in India. If you study in Kilpauk Medical College like I did, do post-graduation in Trivandrum Medical College like I did, what makes the change? And I would humbly suggest that the change is the fact that we have two systems of medical care in India. We have the private system for those who can afford it. Probably not a single one of you has ever gone to a medical college for treatment. And then you have the medical colleges, which are, ever since the 80s, it's only for the poor. And this new scheme, Ayushman Bharat, which is supposed to be for the below poverty line, medicine for poor people will be poor medicine. Take it from me. It cannot be otherwise. The doctors who sit in such things will be the ones who are despised. Which are the doctors who are looked up to in society? The ones who wear the white coat and come on TV programs, all from Apollo Hospital. They have the brand. Little do you know that they are slaves to a corporate. They are not free men either. They are not happy people either. They pretend to be happy. Among the doctors, they may sit there and, okay, we get social prestige. What happens when you go home and you have to sleep at night? That's the question we have to ask. And that's the question which I say, this book is not a depressing book actually, because if you can face the fact, then that's when you can begin to change. And if we know that the system in India is bad, it's corrupt, sure, corruption in healthcare exists in India. And we cannot say that it exists in every field. Why cannot it exist in medicine? We can't say that. Because from doctors, we have a right, as society has a right, to ask for more, to demand a higher standard of excellence. Because every day you give to us your body personally. It's a one-to-one interaction. It's not a public health intervention. If you come to me as your doctor, you have to have faith in me, that I will do what is right. So I have to live to a higher standard of excellence than any other person. An engineer who builds a bridge which collapses, sure, but it's far removed. So you don't have that personal touch. And the personal touch is what makes medicine exciting. It also what makes you expect more from the doctor, and it's also what makes necessary for society to protect the doctor. Make sure it can be done right. And present Indian society doesn't permit that. Corruption is inset when you have two systems, a private system for the well-off and one for the poor. The poor doctors who look after the poor will be treated poorly, will be looked down upon, and every doctor who's there will try to be in Apollo. And that's the root of it. You have one system, like the national health system. There are different types of corruption all over the world, but you won't have the type of corruption that you're having in India. David Berger could say what he did because he always had the comfort that he's going back to the UK. He doesn't have to live and work here. That's what makes the difference. So it's up to the society. Make it possible for us doctors to treat you as the way you should be treated.
Now that we have finished the opening statements, and before we start the interaction among the panelists as moderated by me, I want to make an argument in support of the title of the book. And people might want to respond to that, because publishers want provocative titles. And it's not out of line with the content of the book, but the book does. I read the book quite carefully, a large part of it anyway. And there is an acknowledgement that a very large, and I quote, a very large number of doctors in government hospitals and health centers, in private hospitals and clinics, and in public and private medical colleges, quote, remain true to their calling. And yet, the central issue dealt with in the book is corruption, as broadly understood and also very specifically understood. There's a great deal of detail and specific insights in this book, which I recommend to people who may wonder whether it's just hot air. But having said that, may I now turn to the editors first of the book. The issues the book touches upon, Dr. Nandi, low allocation of resources. Amartya Sen has something to say that it is an important factor, but it's only one of the relevant factors. Kavita Narayan characterizes our healthcare system as a broken system. And Amartya Sen refers to a comprehensive healthcare crisis. Of course, we can say this about other sectors like the public school system, the justice system, and so on. And then about the everyday corruption, Dr. Mani in his chapter has many examples of it, so do some others. So you can say that there's everyday corruption, what is often called by corruption research as petty corruption. It's not really petty, it adds up. But everyday transactional petty corruption. and at the other end, grand corruption. And then you have a lack of trust, and also Dr. Thomas has dealt, among others, with the outcomes. Why did you focus on corruption as the central issue to be tackled, and that in effect corrodes the whole healthcare system? Is that accurate, or would that be considered an exaggeration, given all the other problems of the system? Yeah, you can have this.
Shall I use this?
Yeah, it's okay.
I'd like to preface my answer with a statement I made to the British Medical Journal, where in an interview they asked me, what has been your most far-reaching choice of career? And I said that coming back to India was a wonderful experience for me. It made me, because of my refined background, I could try, and didn't succeed, give the best treatment in the world to the poorest of the poor. The poor were very grateful for whatever you did for them. The problems in India are huge, but the solutions are at hand. The problem is that we don't attack the solution, attack the problem in a very kind of intellectual way. And the reason that I thought that we should have a book on corruption was mainly because of David Berger's article, and because I read a lot about it, and it suggests that 25% of healthcare expenses could be lowered by eliminating corruption. For instance, the MRI person in Pusa Road, which is near Gangaram Hospital, where I work, gives a 3,000 rupee kickback to doctors who refer patients for MRI. The cost to the patient is either 6,000 or 7,000 rupees. Now, people say that, well, society is corrupt. Why shouldn't doctors be the same? The problem with the medical profession is that there's a huge difference of knowledge between a person the supplicant, who's the patient who comes to you, and the doctor who knows what the correct treatment is. And Amartya Sen says,
Yeah, this is good.
Amartya Sen says in his brilliant foreword that when you go to buy a toothbrush, you know as much about the toothbrush as the seller of the toothbrush. But medical care, you depend on a doctor, and the doctor you must trust. And I think that we mustn't underestimate the number of doctors who are corrupt. Because I went to KEM Hospital in Bombay to do exams, and they were telling me about corruption in Bombay and the kickbacks and all that. And they said that 90% of GPs in Bombay give kickbacks. And I asked a friend of mine, Dr. A.G. Desai, who's not there anymore, is this true? He said that this is an incorrect figure. It's 99%. And I think that we are in a privileged position. We have a country which needs us. And I think all this universal healthcare stuff is impossible in India because we just don't have the money. We can have basic healthcare for the poor, but I think that what has happened with the corporate hospitals and private hospitals since my time here is that Indian healthcare has reached the highest levels. For instance, I mean, in a field in which I'm interested, liver transplant, the most complicated operations are done here, and the results in the best centers are equal to the best in the world. Unfortunately, 98% of these operations are done in the private sector.
If I may ask Dr. Mani a similar question, pointing out that you have a sort of historical timeline going back to your early days as in the profession, and you remark there, you observe that these malpractices and corruption may have been the exception in those days. Today they have become the rule. So how has this normalization of deviance happened? And when did it happen?
I think one of the first things was the influx of high-cost equipment. When people started having CT scans and MRIs and things like that, it was a large capital inlay, and people wanted to get something back. So that's where the kickback system started, and I believe it has existed in Tamil Nadu for a long time, but in the early days, when we were early days of our practice and working in the hospitals, whatever it was, the expense was not that high. So a kickback would not be all that much. Even then, as I pointed out in my chapter, some surgeons would insist on a patient coming to the house and consulting them before he could get operated in the government hospital. So that was in existence even in those days. But all that was small change in comparison with big things now, like all these lithotripsy, CT scan and so on. So that is when it became large scale. And the second thing, of course, was capitation fee medical colleges. When people spend colossal sums of money to get a degree, they expect a return. The people who put it in are obviously have to be business people or to have that kind of money, and they want a return from it. So that is what I think led to the onset of the corruption, and now there is no limit. It goes on.
You talk about the business of admission to medical colleges, advertising in medicine, corruption in government hospitals, inducements given to and received by medical practitioners, on which you have commented, abetting the patient in crime, you said that, issuing false certificates to avail of leave or to avoid attendance in law courts or to avoid going to prison cells, insurance fraud, transplantation and organ commerce. Would you like to comment on that part, the last one?
I'm afraid if I start talking about the problems in transplantation, we won't finish the meeting today. The largest amount of corruption is, I'm sorry to say, in the field of transplantation, starting from the exploitation of the poor who are as unrelated donors. And one of the things that you would have to think, even though there are strict laws which say that unrelated transplantation should only be altruistic, this altruism comes from the slums of Chennai to the millionaires from different parts of the country. And that is where the altruism goes. It is obvious that the only reason why a slum dweller in Chennai would give a kidney to somebody who is a millionaire from Kanpur, shall we say, is because of money. But somehow the authorization committee appointed by our government has never been able to see that. They seem to, this is one of the authorization committee members some years ago told me, he says that, or she says that she loves him. Who am I to say that it is not true? This is the answer which I got. I don't know what else we can do. This is massive corruption. And even in terms of the deceased donor program now, we do have corruption coming in different ways, in that some people may get the kidney in advance of someone else, that they can move up on a waiting list. And the other thing is obviously that people from overseas are getting transplants quite freely over here. Somehow the impression that there is no Indian who can receive, because no foreigner should get an organ from India unless there is no Indian who can take that particular organ. And yet we find that a large number of these transplants are being done for people from overseas. That is really a big can of worms. And I think we should get to the bottom of it sometime, but I don't know how it can be done.
Keshav, now that you're free from the fetters governments place on senior civil servants, and you were Union Health Secretary, do you think, now weighing the various factors that have been mentioned in this book, inadequate spending on healthcare, weak infrastructure that you mentioned in the introduction, lack of research and lack of standards, maintenance of standards, and corruption, how would you, in a hierarchy or in weighing those different factors, what's your sense?
Yeah, these are all important. I think the first thing is undeniable. We do not spend enough. Between central and state governments, we certainly ought to be spending more. And we must give credit where it is due. 2005, when the National Rural Health Mission was introduced, it was for the first time possibly such a huge influx of public money into primary health care. So that continues to date. That what goes into what is now called the National Health Mission is still a sizable amount, but it's nowhere near enough. But a second point, which I think is more important, is that we like very much building hospitals, we like buying equipment, because at one level these are easier to do. Also, it's easier to make money on these things. This additional investment that we need from the public sector really needs to go into medical education. This, Dr. Mani mentioned this huge influx of private medical colleges charging capitation fees, which came about because of a decision of government in the early 90s, when the Indian Medical Council Act of 1956 was amended to permit the setting up of medical colleges by private parties. That is completely, imbalanced the situation so drastically. What we need is state governments putting money into state government medical and nursing colleges. If you can have medical and nursing colleges that charge a normal kind of fee, then there is some expectation, A, that those students will have a sizable patient volume to look at during the course of their studies, and B, that they will be able to afford to come into public service when they are finished with their education. If they've paid 3 and 4 and 5 crores to acquire a degree, they're not going to come to a government job. Tamil Nadu is unique amongst Indian states in that they've recognized this a long time ago. There are possibly one government medical college in every district. All of UP has 8 medical colleges in the government sector. So you see, there is something grotesquely wrong, and that space is being taken by private colleges. So it's not just that we need more public investment. We need public investment in health human resource training, doctors, nurses, more postgraduate seats, because you do need a certain number of specialists, and in this whole huge area of allied health care, which is completely unregulated. In my house, I can start an ICU technician course, and I will produce ICU technicians who will get jobs. Because there are ICUs in every private hospital who they want somebody with a piece of paper saying, I am a trained ICU technician, laboratory technician, X-ray technician. Kavita Narayan, who's one of our contributors, has done absolutely stupendous work in this area. There is now government has a list of something like 113 allied health professions, and curricula and syllabi are being framed for each of these. Now these need to be regulated, and the process has not come to an end. But this is the kind of stuff we need to do. And then we will be in a position to create these wellness centers that Ayushman Bharat is promising. I can't have a wellness center unless there are qualified people to do something there. Tamil Nadu, we may still, because of the reasons I mentioned, you may still have MBBS doctors, in every primary health center. In large tracts of the north, you don't have any doctors at all in the primary health center. Now, unless you produce these people, we are not going to have any kind of primary care, and that's where the money should go.
say so?
Dr. Money first.
Yeah, on the subject of limited funds and what you can do with it, I should like to comment on the work of the Kidney Health Trust in Chennai, which has a simple program, very cheap, by means of which by home domiciliary testing for diabetes and hypertension with an annual survey, we have been able to pick up a large number of people with diabetes and hypertension and treat them with cheap drugs, keep their blood pressure and diabetes under reasonable control, and have lowered the incidence of chronic kidney disease in that population from 28 per thousand to 11 per thousand. This is possible. And the cost was 33 rupees per capita of population, not per patient, per capita of population per year, well within the budget of the government. This is the sort of thing that we really need to do. We need to try to keep people healthy, and we need to spend a lot more time and effort on that. And if we can keep people healthy, we will prevent a whole lot of other diseases, which anyhow we don't have money to treat.
May I just add one little thing here? When this trust won an award, Dr. Money forbade us from even publishing it in the press. I remember that very well, saying, I don't want that kind of recognition. Anyone, is that true or not? That's the kind of physician we have here, or physicians and surgeons we have here.
I just want to say that one of the major deficiencies in Indian healthcare is the lack of research. And Dr. Money's research is something that Dr. Money has done. For instance, you see what the prevalence of hypertension, diabetes, or kidney failure is in a population. Then you intervene. You do a simple intervention, or you do no intervention, or you do a complex intervention, and you see what the result is. And we did a study of the publications from Indian medical colleges, Indian institutions. There were 570. Between 2005 and 2014, 57% of them had not published a single indexed paper, research paper. Such is the quality of our medical training. And people say that the quality of research output from a medical college reflects the standard of the medical college. And this paper was quoted by 50 papers and medical journals, and the Washington Post had a headline which said that if you think Indian medical education is bad, it is very. So I think that it's time that not only should we give good patient care, we should look at research in India which is relevant to our nation's needs.
So on this question of this money allocation, I think even as doctors, we're too willing and to easily accept that there are no resources. This would make sense if we don't see the humongous amounts, like mind-boggling amounts, 1 lakh crores written off, 1 lakh crores given to some corporate. It would make sense. I mean, I would believe Dr. Nandi if I never saw these things every day in the newspaper. We cannot accept this. We do not elect governments to say things as they are. We elect them to change the things. And we need, if we do not demand, if we are so easily accepting there's not enough money, therefore there will be private, it's a wrong philosophy. I have a fundamental difference in philosophy from many of the people right now on the panel because I do not believe this. And I do not think that we should be, and Daniel Kahneman and Amos Tversky, in Thinking Fast and Slow, they say, unfortunately, human beings, they grab onto these things, like liver transplant. Oh, it is the most magical thing. Actually, it has a very, very, very small impact on health outcomes. But who wants to read what the World Health Organization says about health outcomes? Who wants to read where the money should really be going? We are all after this doctor. Oh, he can do liver transplant. He can do it the fastest. He can do it the best. That doesn't really affect anything. Minuscule number of people need liver transplants. For this, we are spending huge amounts of money. And why are we looking at parameters from the West? Washington Post says that Indian medical colleges are bad. Do we need that? not me. I am an Indian, and I know why medical colleges do not produce research. Indian medical colleges, if you work there, you have no time for research. You see 100 patients in an hour. If you are living in the glorified ivory tower of AIIMS, you get protected time for research, or I'm the Institutional Review Board chairperson for the Christian Medical College, Vellore, so I'm very well aware of what I'm speaking about. Christian Medical College is, after AIIMS, the second most highly publishing medical college in India. AIIMS is first, CMC is second. I'm the IRB chairperson for 10 years. They get protected time. Is Christian Medical College a scalable model? It isn't. What we really are, the scalable models, are all these government medical colleges of which Samiran Nandi thinks so little. Please go there. Between 7:45 and 1 p.m., you may have to see 300 patients. At the end of it, what you'll do is lie down flat, like I used to, and my dear wife used to. Every day of her life. I'll have to wake her up because she's too tired to do anything else. That's the reality of medical care in India. And unless we know that, we stop looking at this research stuff. Right now, what we need is patient care. For that, what do we need? We need more money. And what do we need? We need not focus on liver transplant. I believe that if we are a proud country, every person in the country should get the same level of treatment. If the Prime Minister of India can get a liver transplant, Munusamy from Gumadipundi also should get. If Munusamy from Gumadipundi can't get a liver transplant, nobody should get. Unless we have that philosophy, we're getting nowhere. Let's not believe universal healthcare is a myth. No country can afford healthcare. That's what the statistics say, but they all do it.
Now, I would like to question one of your assertions in this, in your chapter. In fact, what you're saying now is rather different from what I read in your chapter, in the book. It's totally, yeah, because I read that quite carefully. The chapter comprises hidden fees, unnecessary investigations, unnecessary procedures, errors of omission, poor standards, tendering process, medical education, and then, quote, in summary, the consequences of corruption in healthcare are denying medical care to many, impoverishing the already poor, and an assault on the patient's body if he or she has to undergo an unnecessary procedure. It causes a trust deficit in society between the patient and the doctor. It damages one of the vital institutions of modern society. It causes conflict in the doctor's mind between what should be done scientifically in the patient's best interest and what's actually done in the doctor's interest. So you talk about confused thinking for the doctor, and I think the tone there is, and the content is rather different from what you said here. But I just wanted to question one assertion you make, or invite you to explain it or defend it. Quote, practicing scientific medicine will automatically mean practicing ethical medicine. I recall that, so scientific medicine can be interpreted in many ways, but if it's largely professional, evidence-based medicine, I don't see how it will automatically mean practicing ethical medicine. Because I recall a parallel with journalism. A long time ago, Walter Lippmann, one of the great thinkers on journalism and on writing, was bothered about the problem of the propaganda role that debased the performance of the media. And he considered professionalization, whether it could be an answer, and came to the conclusion professionalization is no antidote to the malpractices in journalism, including the propaganda role. But how would you defend it, this particular statement?
Okay. First of all, I like being challenged, so thank you. The first thing is that, first of all, I must define what did I mean by scientific medicine. I am a hardcore believer of the Popperian view that in science, you make a proposition which is subject to falsification. If the proposition is not subject to falsification, it's not a subject for science. So that's the method which I mean is a scientific method, as defined by Karl Popper. Maybe others said it before him, but Popper wrote about this. Therefore, I believe that if you get a patient who does not require an MRI, you won't send for the MRI. So you won't get the kickback. So that if you are only going to practice scientific medicine, and you know that this patient needs an MR. And therefore, I'm going to send him for an MR. And if I am affected by the fact that I'm going to get 3,000 rupees for that MR, then my brain is already altered. So I'm not following scientific medicine. Therefore, I will be ethical. That's, in simple words, what I meant.
But how is it automatic?
If you are always scientific, then that thought comes in. When I offer you a surgical procedure, is it because it's the right thing to do or because I'm going to make money out of it? If it's the right thing to do, it's because I'm scientific. If I'm going to make money out of it, then it may be scientific, but it's also because I'm going to make money out of it. It's distorted. Yes. Oh, tautology, okay.
I want to defend here the practice of liver transplantation in India. I've given a lecture, in fact, in Chennai about 3 months ago on the history of liver transplant. It started really when Rajiv Gandhi came back from one of the tours abroad, and he said, why aren't we doing heart and liver transplants in India? And the health minister set up a small committee, health secretary. I was one of the 4. And we defined that there were 4 things that we needed. One was change in the law, because people were selling their organs and we wanted to stop. Second was recognition of brain death. The third was expertise. And the fourth was sensitization of the public. And in 1994, the Transplantation of Human Organs Act was passed. And today, we have 98 liver transplant centers in the country. And why should we have liver transplants? 2 lakh patients die of liver failure every year. The rich used to go abroad and get a liver transplant for 2 to 3 crores. You can get a liver transplant in India now for between 20 and 30 lakhs. Second, liver disease affects the young people. Thirdly, if you have liver transplant, you immediately, the quality of service, both of the doctor and all the ancillary departments, is improved. And fourthly, there is a national pride in that we can achieve what other people have achieved. I disagree with this idea that we should go down to the lowest common denominator and spend money on only providing clean drinking water and no high-class healthcare.
Yeah, I'd just like to say one thing. When you have a limited amount of money, we're not talking about people who can spend their own money and have liver transplants, but if you have a limited amount of money which you're going to spend, it would be much better to prevent the disease at a lower cost than to treat it after it comes. So I believe, therefore, that we should do far more on primary care and prevention and try to keep people from getting all these terminal stages.
So may I ask, what is the state of preventive medicine in India, in some of the areas you are familiar with?
I won't say it is non-existent. Definitely there is a significant amount of work which is being done. It is public health which has eliminated smallpox from the country, which has eliminated leprosy to a large extent, maybe some degree of control of tuberculosis. All these have been based, and these are based on domiciliary programs. I believe that when you've got a man working on daily wages in a village, and you expect him to travel 10 kilometers to a primary health center and stand in a queue for 4 hours to get medicine for 1 week, it's never going to work. We have to do a lot more at home. The answer to these things really is that much of our work will have to be done at home. It does not require very highly qualified people. It doesn't mean I want the doctor to go to every house, but a sort of screening program can be established, and then we can have those people brought to the doctor. The doctor can go to a village and see them, as we have established in the work of the Kidney Health Trust. So I believe that we should spend whatever money we have. First thing is, we certainly need to spend more. That I have no doubt at all. We are, as Thomas pointed out, that we are spending a lot of money on many big things which are not really showing any kind of return. So we need to spend more rationally. The money has to go to the health budget as a whole, and it has to be spent properly without being lost on the way. And but with that money, whatever we have to budget it. That said, I believe that we should offer facilities for liver transplantation, kidney transplantation, at least in some hospitals, because we have to teach people. The younger doctors will have to learn how to do this. A time may come when the costs will come down, and we should have the expertise in the country to do it. But it should not be that the government spends all the money on that at the expense of looking after the health of the common man. That should not happen.
By the way, this is being live streamed on at the Hindu Center's website, the Hindu's website, and also on our Facebook page. So welcome to the people who have tuned into this. But Keshav, if I may ask you, how does policy relate to preventive medicine, preventive strategies, public health interventions? And in particular, we heard that Tamil Nadu is ahead of many states in this respect. Is that true?
Well, that is true, certainly, in that Tamil Nadu is possibly the only state which for many decades now, certainly from before independence, has had within the health department, a public health department, and the clinical faculties, that the people who run the hospitals. And actually the biggest policy problem is the lack of appreciation within governments. Governments tend to be very governments tend to work in silos. So there's a lack of appreciation of the fact that a good, robust nutrition policy is an essential feature of a good, robust public health policy. That ICDS, or the system that runs the Anganwadis, it's not a standalone program where children under the age of 6 come, get something to eat. And there's a reason why children under the age of 6 need to be fed appropriately nutritious food at the right time, which they may not be getting in their own homes. That also, likewise, that the importance of safe drinking water, sanitation, household ventilation, for instance. I remember reading this somewhere, that the single largest killer in India are domestic indoor air pollution caused by bad cooking stuffs. Now, that all these things, government knows about all these things, but does not see the connection between them. That if you want to have a healthy population, you need to address these not as in standalone programs, but as part of an overall health policy, and that these will contribute towards having a healthier population. The second thing governments need to understand is that you are not going to see results before the next election. Investing in healthy, nutritious food for children below 6, the impact of this you will see 1 generation from now.
Mr. Modi needs to understand that. Right?
Of course, everybody needs to understand this. That you are not, which is why I was saying earlier, all governments like to build hospitals, because you can do that. All governments like to say that I've installed some cancer equipment in this, or an X-ray machine. There's under the scheme of MPs have local area development money. A lot of MPs and a lot of MLAs like buying expensive equipment for the hospital in their constituency, irrespective of the fact, are there people who know how to use this? What is going to happen? Who is going to maintain this? Do you have money on a recurring basis to keep this equipment functioning? But then that produces an immediate splash that, this has been donated. But we need to invest in things where you are not going to see the results A very important example that everyone in public health should know is in the United Kingdom, how did they drastically reduce the incidence of tuberculosis? Because their national housing policy changed. Row housings was given up. And everyone recognized that houses need windows. And it's a clearly documented, properly evidence-based result. That kind of stuff we don't have the patience for. But also possibly because the size of the problem is so big. There are people all around us with horrible diseases, dying in great pain, distress. You want to do something. But always looking at the immediate and urgent doesn't mean that you shouldn't be looking at what may not be immediately obvious to you, but it's also hugely important.
Some 10 years ago, a former student of mine who was a nephrologist in a neighboring state and knew the health minister, he went to him and suggested that they take up the prevention program of the Kidney Help Trust there. The minister said, if I do one transplant free, I will get headlines for 3 days. I may prevent 1,000 people from getting kidney failure. Nobody will talk about it.
Actually, whenever we say a problem is large, we have to remember that in 1947, when at the time of independence, all problems were large. And P.C. Mahalanobis, who started the Indian Statistical Institute, he was tasked by Nehru, this whole question of hunger in India. We had famines regularly, and it's been eliminated. We don't have famines anymore. That was a huge problem, and India solved it. So if we cannot solve the health problems, the major health problems of India, it's simply because we lack the political will. People are not asking for it. There is no such big problem. You solved famine. How can you not solve this?
I think before I invite questions from the audience, since most of us haven't read the book, I just want to briefly flag the conclusions or the lessons, broad lessons learned, so that you can question the panelists more specifically. One lesson is that public health, or conclusion, the most important, they say, is that public health must remain a public responsibility, and neither the lack of financial resources, the inability to manage systems, the unwillingness to govern responsibly, nor an unfamiliarity with technology should become an argument or excuse for outsourcing healthcare to private enterprise. Public health must remain a public responsibility and no excuses for outsourcing healthcare to private providers. Secondly, the history or the current implementation of health insurance schemes. That's already been discussed at least briefly or mentioned. 3, governments at both center and state levels must continue to be the primary player in healthcare, and certainly in primary healthcare. The specious difference between providing and purchasing healthcare must be called out. That's the conclusion in the book. 4, there's a great deal in which the private or non-governmental sector can and must do. And the examples are given in this book. The great healing traditions of institutions such as the Christian Medical Center, CMC, MGIMS, and St. John's, and the highly professional healthcare delivery through organizations such as the JSS in Chhattisgarh or the Banyan in Chennai. We have here Vandana Gopikumar, a co-founder of the Banyan, and the book goes on to say that this delivers a powerful message that non-governmental civil society activism based on a platform of hard professionalism. Note those phrases. Civil society activism built on a platform of hard professionalism. That would be scientific medicine. Have a role to play in healthcare delivery, etc. And moreover, it's been pointed out that they are substantially free of any taint of corruption. They are substantially free of any taint of corruption because these organizations draw on the strength of individual commitment and dedication to a superior cause. I think nobody is going to challenge that. I think these institutions are highly respected and esteemed and relied upon. 5, a third broad lesson is that information is power. We have already discussed it. Access to information determines the quality of treatment a patient receives. Access to technologies is limited in India. Then no system of healthcare delivery, whether public or private, can function in the absence of enlightened regulation. And that's the elephant in the room, the Medical Council of India. And lesser known bodies also like the nursing and dental councils. And I don't know about the regulatory agencies in the Ayush sector, but there's...
You don't want to go there.
Then a need for a comprehensive overview of the medical curriculum and syllabus. Very little research of any standards that's been mentioned. So these are themes or conclusions that figure in the book. And I repeat, they pay tribute to quote a very Dr. Thomas took umbrage at people questioning the commitment and integrity and so on of doctors, although they coexist with corruption, he said, or indicated. But the book does acknowledge a very large number of doctors in government hospitals and health centers, in private hospitals and clinics, and in public and private medical colleges who, quote, remain true to their calling. And everyone here is true to his calling. And we also have many in the audience who come from the medical profession. I think they are true to their calling, I would expect. The question is, corruption in the healthcare system is not a pathological, is it a pathological condition, or has it become normalized? And the book tends to lean to the view that it has become normalized, it has become systematized, and it's no longer the exception, it's the rule. It's largely the rule, although the extent to which it is a rule can be questioned or criticized and so on. So these are the themes of the book, the conclusions in the book, and I think I would recommend that everyone who can afford it buy a copy of this book. It's already doing extremely well. A lot of people are interested in it, among other things, thanks to the title, which attracts. I think you need titles like that to provoke thought. But now I would invite questions from the audience. Please keep them brief, to the point. We don't want long statements unless somebody has some new information to provide. Please make them in the form of just questions. Yes, please introduce yourself.
I'm Meera Raghavendra Rao, a freelance journalist and an author. This question is to Dr. Mani. I would like to know how many doctors in Apollo belong to the conscientious tribe.
I have done many scientific studies, but I'm afraid that is not one that I have studied well. Let me say one thing. Every doctor, even a corrupt doctor, wants his patient to do well because he wants the reputation to come. Whatever the methods that he uses and whatever the money that he tries to get, he wants to get a good reputation. So every doctor is trying to do the best for the patient.
Through scientific medicine, would you say?
Largely through scientific medicine. But there is maybe a little bit of an excuse also for a for a doctor who over-investigates a patient. And this is the litigation which has come in. Now, if somebody does not do a particular test, and the patient may then go to court and say, or the patient's relations, if the outcome is bad, say if only this test had been done, it would have been. There is a little bit of a breakdown in the doctor-patient relationship and the trust, that it's become a little bit of an adversary effect. And that certainly applies much more in private hospitals than it would in the public sector. So it works both ways, and somewhere or the other we have to break it. I don't know how we are going to get that done.
Please introduce yourself.
என் பெயர் கோவிந்தன். நான் மருத்துவன், சர்ஜன். ஸ்டான்லி மருத்துவமனையில்
He's a surgeon.
பணியாற்றி ஓய்வு பெற்றுள்ளேன்.
He's retired after working in Stanley Medical College.
Yes, sir.
Hospital.
இந்த விவாதத்திற்கு பிறகு நாம் என்ன தொடர் நடவடிக்கை எடுக்கப் போகிறோம்? கேள்வி 1.
First question after this is, what are we going to do after this discussion, of this reflection? What are we going to do next?
Yes. Next.
Second.
Piecemeal attempt at piecemeal reformations. Will it work, or have we to consider about total reformation with reference to corruption?
You heard that.
The situation in India is similar to the situation in the United States in the beginning of the last century. The Carnegie Foundation sent Simon Flexner from, I think he was at Harvard or Yale, to suggest how American healthcare could be changed. Flexner traveled to Europe, mainly to Germany, which was the leader of medical care in the world then. He came back and transformed American healthcare. There were 300 medical colleges. He reduced it to 130. He said that he laid down standards for medical education. And he said one of the primary purposes of a medical college is to do research, and to do research into American medical problems. I think that we should have another Flexner here.
Dr. Mani, would you like to add anything? Dr. Thomas, to that question? Piecemeal or wholesale restructuring?
I think we can talk about it, but the way to get it done, I don't see a solution. We cannot get a Flexner to do things like that over here because nobody will listen to him. He'll always say that I'll get more headlines if I do one transplant than if I prevent 1,000.
Piecemeal is the Indian way.
Thank you, Mr. Ram. Yes. So the mission-oriented.
Please introduce
okay, I'm
yourself.
sorry. I apologize. Karuna Niti, I'm a physician, sir. Thanks for coming to Chennai, the health secretary and the people, and it's nice to have our own.
Former health secretary lives in Chennai.
Oh, I didn't realize. So nice. Welcome. Yes. Okay. Sir, okay. You are the one. Okay, from the sir. Again to the extreme person, Dr. Joseph's view that the role of non-governmental organization as a safety net for the society, the government's role, and how do you survive with this? I mean, with this corrupted environment, you people, you thrive well. So why can't you expand? The government, does it help you, or who can help you to? So I think for the solution is only from the non-government organization. Nobody trusts the government hospital. None can go to Dr. Mani. And I'm not talking about his hypertension prevention, but I can't go and get transplant done by him. So the solution, I think, is from the non-governmental sector. Could you please highlight your future plans?
Actually, unfortunately, I feel that even though I'm not working in Christian Medical College, I work in St. Isabel's Hospital. I was a student of Kilpauk Medical College, Trivandrum Medical College. I worked in railways, before railways, Government of Kerala. So I'm an ordinary, very, very ordinary man. Okay, so unfortunately, I don't believe that models like Christian Medical College, any of them, they are not scalable models like Varda. The only organization which can do this on a large scale is the government. They are only people. So we must have universal health care and we must demand it from them. See, Dr. Nandi was a little unfair to me. I didn't say that liver transplant not important. What I said is, if the Prime Minister gets it, Munusamy and Gumadi Pade should also get it. So every Every intervention available in India should be available to everybody else. That's a fair society. This is a democratic country. We are not in a dictatorship or in a kingdom. Even the Queen of England goes to National Health Service. That's all I'm asking. And I believe, because Dr. Mani said it, unless they go to that same hospital, it won't improve. So we must have only one kind of hospital. In Germany, there's insurance. I went to Germany many times for getting training. Everybody gets similar care. Similar. Maybe slightly different, but similar. Unless we get that, nothing is going to change.
He wanted to know how you move towards that. And you said piecemeal. Keshav, yes.
No, Dr. George has really said what I wanted to say, which is that we are blessed in that we have in the non-governmental sector extraordinary women and men in our country, not just in healthcare, but in other sectors. Some of them are contributors to our book. But he's absolutely correct when he says that just because government is failing, we cannot say that let other people take over this job. It is government's job to do it. We should be grateful for the remarkable people there are in the non-governmental sector, especially working. Mr. Ram mentioned Vandana and her work. Yogesh Jain is a contributor. We have Poonam Natarajan and Radha from Vidyasagar here. These are outstanding examples of civil society working in areas where government really doesn't know too much. Vidyasagar, for instance, works in the care of children with disabilities, which a great deal of what is now good practice in India comes from organizations like this. But that does not mean that it becomes their work full time. These are jobs that government needs to do, and that's what we've tried to say in this book.
That's any other questions? Yeah. Okay. Many hands up. No, he is. I can't see in all directions. So there are many hands up.
My name is Dr. Ganesh. I am working in ESA hospital as a senior medical specialist. The title, we are focusing on something which is negative. We always should talk about light, and the absence of light is darkness. The corollary is we should be talking about honest persons, and a set of honest persons should be supported. A set of dishonest persons, they are thriving because you are not supporting the crux of the doctors who are doing good work. Like I can claim, I can vouch that in my hospital, anybody can come, and without my knowledge, go see for yourself, ask for yourself. You will get the picture what I am trying to tell you. The ESA hospital, ESA corporation has given enough powers for us to do all the things, including the liver transplant and other things. And these patients, these employees, they are getting the best of the treatment, and the standard of care which these people are getting from my side, as a physician, and from all the departments of our hospital is so noteworthy that why people like you from the journalist group have not even touched such wonderful examples.
There's people tend to vote with their feet, and 75% of Indians pay out of pocket for healthcare, and only 25% of them go to government hospitals. And I have experience of ESI hospitals in Delhi and elsewhere, and I'm sorry to say that they're not a patch on the best hospitals in India.
Please come to our hospital.
No. Now, one issue here is, I think there are plenty of stories in the media, not enough, maybe not covered your hospital, they should, about good work being done, but if you only talk about it, that will amount to propaganda. And you will miss the big picture of what is happening. Please read the book to see whether you agree with the evidence provided there, the stories provided there, the insights provided. No, don't interrupt me, okay, please. We heard you without interruption, so give us that courtesy. So, yes, I recognize it is quite possible. It looks highly likely that there are these commendable areas. But in my observation, newspapers as well as news television, they cover this to a significant extent. Ask the Banyan, for example. Ask CMC. Is it enough? No. But if you have left out interesting work, it must surely be covered. People should know. But we are not in the business of raising morale or feel-good journalism. So far as journalism is concerned, and we are very happy that people here who have much more experience in this area than any of us can have, speak to these issues in a bold and honest way. Honesty is the key here. If you merely talk about good things, you're not being true to what is happening out there. You're letting down people and so on. That's my answer to your comment on the media not covering this. Yes?
Would you want me to say on this also?
No, not now. Yes, you were next. We can have this conversation after.
Yeah. Thank you, sir. I'm Ainangsha. I profiled many with celebrated doctors, but I attend the government hospitals in the villages, and I'm doing my doctoral studies on foreign policy. My question, sir, I'd like to say, when you say doctoral studies on foreign policy, so I would like to say, when you say about healthcare, this is a very much inclusive industry. There are many things that are getting included inside. For example, AI is coming, big data is coming, health informatics, all these things are coming. My question is, all these things are coming from the US. Anyway, when you talk about the healthcare, we only say about basically the allopathic treatments and all. All of us haven't talked about here the homeopathic and the other kind of and the forms of treatments which are much more affordable, much more cheaper, and which are practiced largely in the countries of South Asia, basically in Bangladesh and eastern portion of West Bengal. So are we anyway celebrating the triumphs of Cold War? When you mentioned about the Rockefeller and Carnegie Foundation, you mentioned, sir, just a few ago. Anyway, is it a subsequent of the Cold War? This is the anyway, this is winning this Cold War period?
The question is clear. I think we are not dealing with indigenous systems of medicines, whatever the claims are, and I don't think that's really relevant to the book, but Dr. Nandi wants to say something.
I just want to say something on homeopathy. And there have been many studies which have shown that homeopathy is completely useless. And it is time now that we should get rid of it from this country.
There's a law against quackery and charlatanism. Keshav?
Well, since the question of what in government is called the Ayush systems has come up, I think two very quick points. Our government recognizes the Ayurveda, Yoga, Unani, Siddha, homeopathy, and there's a sixth form of Tibetan medicine which is recognized by government. And so at this point of time, that is our policy. My understanding is that corruption in the regulation of this sector, whether through the Central Council of Homeopathy or the Central Council of Indian Medicine, is far worse than in the MCI. It's a whole new story which we have not addressed. But the only important thing I believe about the Ayush sector is that Ayush hospitals and Ayush doctors should certainly be encouraged to work within their own discipline. Every so often you see someone in government saying that Ayush doctors will be given a bridge course and be made to work in practice Western medicine. This is something that we should prevent against. Ayurveda hospitals, Unani, Siddha hospitals should certainly be encouraged, and properly qualified Ayurveda, Unani, Siddha doctors working in those hospitals. But let us not pretend that they are equivalent to somebody who has been trained in Western medicine. The temptation for this is because there are huge numbers of these people who are all over the place. And if you're just talking about numbers, it's quite easy to say, well, all these trained doctors are there, let them come and staff the PHCs, let them come and staff the district hospitals. It can't happen. They can practice what they've been taught to practice.
So there are a few issues I would like to flag. I am Dr. Manjula Datta. I retired as Professor of Epidemiology in the university. I left a good career in the ICMR to take up this job in the university because I felt that we need to do something about improving medical education. I felt very strongly that we needed to do. I created two departments, a department of epidemiology and a department of curriculum development. And at that time, this was in 1998, nobody knew what was the amount of burden of illness in this country. Nobody knew what types of illness, what is there. This in spite of 2 or 3 surveys, 3 national health surveys that had been carried out by the government, the central government. Nobody had access to those data, even though it was on a website. It was so confused that we could not draw anything from that. What is important, I feel, is, I mean, there are 2 things. We don't know what illnesses our people suffer from. We need to know that immediately. And our medical curriculum is imported from US or UK. We teach our medical students everything that is there in Harrison or some other exalted book, but not what is there in our country. These are 2 points that we need to really improve. And talking about primary health care, there is another issue that primary health care is confused with public health interventions. Primary health care is what the patient needs at the first point of care. Are we providing anything at the first point of care, namely the PHCs? Nothing. And are the PHCs accessible to the patient so that they can get care when they need it? That also we don't have. And therefore, if we think of restructuring medical education or medical care in this country, these are points that need consideration. And one question I have for Dr. Nandi. Sir, since Amartya Sen has given a forward to this book, I can talk a little bit about health economics. We have done several liver transplants. I don't know the number. We have done several transplants of lung, heart, etc. Have we done any follow-up studies on these patients to see whether they are A, healthy, and B, productive? And how many years of productive life they give to the country?
There are many studies on this. And the best centers in a person who's dying of chronic liver failure and some who have acute liver failure, if they have liver transplant, in the best centers, they have a 90% survival, and about 84% of them live 5 years, and about 75% go on to normal life. And the liver is particularly gifted in that it does not tend to get rejected. And once a person gets used to the liver, then he can live a nearly normal life. There are thousands of studies on this all over the world, including India.
Have they contributed in monetary terms? Have they contributed? Have these people made good the amount of money that was spent on them?
But why should it be monetary? Just living, isn't that enough?
So no, when you look at it from the government perspective, so much money has been spent on them. Have they given that much back to the country? That's my question.
Yeah. Yes. This gentleman here. No, behind him. There.
I'm Dr. Chandrasekhar. I'm a dental surgeon by profession. I had 2 unique jobs. One, I worked 20 years in Cancer Institute. And directly opposite, I worked in a private dental college when they started a college. Now, because we are talking about healthcare, I think it is totally different from medical care. Now, when I was working in a private dental college as a professor and HOD, the amount of corruption in a private dental college, I don't know. They say it is a surprise inspection, and that surprise inspection we know 1 week before. I don't understand how. So is it the DCI concerned gives us the time, and all the microscopes from an engineering college is moved to the dental college. All the engineering students wearing a coat are sent to the dental college. And all the register overnight are written for 100 number of patients. And this is the state of affairs. Now, who is responsible for this? It is the government. Whether it is a state government or the central government, I do not know. And what is the outcome of this? I used to joke, if the college owner gets sick, probably if a college owner of my college owner has a toothache, he will not be prepared to have it done by his own student. And dentistry is flying high now. It is out of reach of poor.
Yes,
Thank you, sir.
You know, I think you've answered your own question. It's, yes, government has regulatory oversight, but everything you've said is absolutely true. This is true of all private medical and dental and nursing colleges. Everyone is complicit. No, please let me finish. We heard you out. Please let me finish. Everyone is complicit, whether it is the management, the senior teachers, professors. You may say that, look, they are under pressure, they are protecting their jobs, whatever the reason may be. Everyone participates in this charade of a DCI or an MCI inspection. So while it's easy to say, no, government is responsible, government must do something about it, I think let's not forget that we have all participated in keeping the system active and flourishing and healthy. And I think that therefore it has to come from within. The entire community of senior medical educators and professors and doctors who work in the sector must say, enough is enough. We will not tolerate this sort of demand from the councils. We have one of our contributors, Amrita Patel, chairman of the Charutar Arogya Mandal in Gujarat, the long-term CMD of NDDB. She writes very openly and courageously about the hellish problems that they have had in coping with the MCI and what they have suffered as a result of not yielding. And they have still not got many things that they are supposed to get, but because they have said, we will not pay. Now you need more people like this.
Professor Venkatachalapati.
This address to Mr. Desiraju. Can you say something about the pharmaceutical industry and what role it plays in this whole murky business of corruption?
Deals with it.
Professor Salapati, this requires a whole separate discussion altogether. But very simply, I think the point is that now we are talking about the billion dollar industry. And India represents both a huge manufacturing base as well as a huge demand for medicine, drugs, and pharmaceutical preparations. Are we a victim of the pharma multinational that promotes an aggressive hospital-based treatment that requires high-intensity medication at all times? This has been often discussed. Certainly, if you read Yogesh Jain's chapter in this book, he will tell you exactly why that is not necessary. You need not, it is true, that is certainly happening. It's possible that our large hospital chains are drug-based, drug-driven, but it need not be true also, as in not just in primary health centers, but in fairly well-equipped hospitals need not be driven by the compulsions of having to pander to the pharmaceutical industry. The other very big question is this whole question of regulation, the Drug Controller General of India, the DCGI. And many of you will be familiar with the whole Ranbaxy story where Dinesh Thakur was the whistleblower, and we just revealed how sloppy regulation is in India and how weak and inadequate and underfunded our regulatory systems are. So very quickly to sum up this discussion, I think we will be much better equipped to take on the might of the pharma multinational if our domestic regulatory systems, both at the central level and at the state levels, were much better equipped, much better trained than they are now.
Yeah,
Please
thank you.
introduce yourself.
Yeah, I'm Faizur Rahman. I'm an independent researcher and also the Secretary General of Islamic Forum for the Promotion of Moderate Thought. But of course, since I'm also interested in these subjects, I really thank you for this wonderful talk that has already been given here.
Buy the book.
Yeah, buy the book, yeah. Of course, I'll be buying it, yes. In fact, I was going to ask the question which Dr. Venkatachalapathy asked about the pharmaceutical industry. It is said that they create the disease for which they manufacture a drug later. So that's what is said about the pharmaceutical industry. And connected to that, I would like to ask anybody here who can answer it. I listened to Dr. Aseem Malhotra. He gave a talk recently to the European Parliament where he talks about evidence-based medicine. In fact, he questions it. It all depends upon, he says, the people who are funding it. So therefore, have you listened to the talk of Dr. Aseem Malhotra, the cardiologist from UK? And what do you think about the kind of corruption that goes on in evidence-based research and so-called evidence-based medicine? In fact, I agree with you entirely, Dr. George Thomas, when you spoke about Popper's theory of falsification. I entirely agree with it. I've read both his books, especially that
Stick to the
Open Source and His
question,
Enemies are the
please.
wonderful thing. So I think if you can touch upon these topics.
Who would you like?
Maybe Dr. George.
See, see, scientific medicine, what I like about scientific medicine is that it's open to question. And that's for me, that's, as a human being, that's the fundamental need for any science. I don't like Ayurveda, I don't like, see, by the way, the person who asked, homeopathy is not Indian, okay, it's Hahnemann, German, let it go. But when you have something which you are supposed to take, like the Bible, I'm a non-practicing Christian. Science cannot be unquestioned. So evidence-based medicine, that what is good about it is it's open to question every day. What it means is we are using the best available evidence at the present time. So whatever you say, I have not heard Malhotra, but there's Cochrane collaboration, there's lots of question about this evidence-based medicine. But the misunderstanding of evidence-based medicine is that it gives you a cookbook. On the other side, people will ask, why are you allopathic doctors changing your opinion every day? One day you say cholesterol is good, another day you say cholesterol is bad. That's good science. That's what science is. We have to change. Like John Maynard Keynes, he said, when the facts change, I change. What do you do? So that's me. If the facts change, I will change. So I will keep on reading the thing. And again, I remember Voltaire. Vigilance is the keystone of democracy. So you have to read the evidence with care. The problem is that somebody has to make the evidence. Now, in recent past, funding for independent scientists from universities is drastically dropped all over the world. So even the FDA, the US FDA, it's no holy cow anymore because it's largely funded by pharmaceutical companies in the US. The job of pharmaceutical companies is to make profit. If we think otherwise, we're stupid. Yeah, obviously. So we know that. Caveat emptor. We know that. So we have to look at the evidence carefully. But that's the best evidence we have. And so we have to keep on refining that. But there's no better way. If you can suggest a better way, I'm ready to go with you.
We have 5 minutes more, 2 questions. Why specially activists? Yeah, you can ask the final question.
Yeah, good evening, sir. I'm Ramesh. I'm having a rich experience of pharma industry working as a sales and marketing manager for 25 years. I have worked in Ranbaxy as well as in Win Medicare, Winthrop. See, I have seen many doctors and most of the doctors all over India. I have visited all the corporate hospitals and other things. By the way, what I say is that the government hospital is the best hospital because many of the senior consultants who are working in corporate hospitals are also from the government hospital. Today, the corporate hospitals are buying the doctors. A team of doctors goes to the corporate doctor by paying more money. In Delhi, it has happened. In Chennai, it is happening. So the diagnosis is the basic problem because those who have taken training in the government hospital, they need not depend on the diagnostic facilities to that an extent. Because the experience what they get in the government hospital is much more than the government private hospitals. In private hospitals, you will get the treatment for diabetes-rich diseases.
This is a general comment.
Yeah, not general.
What
This
comes
is
from your own experience?
my own experience. I am telling you, the corruption level is very high in this matter. Right? This is the second book which I am going to buy, and first book was Dissenting Diagnosis, written by Dr. Ajay Garge at Shukla, Arun. Yeah. This is the second one. So what I feel is that the doctors themselves have to educate themselves not to be corrupt.
Thank you.
That is it.
Gentleman there, and then the activists finally. That's it.
I am Dr. Arul Pichai Narayanan. I am a surgeon by profession, and I have been working on national healthcare policy for the past 30 years. I am sure the interesting topic which has attracted every one of us is going to be changed in another 20 years. Are we being treated by the qualified doctors? How they are being produced? That's going to be the situation. And I'm happy it's not going to be a question to the panelist, but question to everyone. I have been attempting to pull the public to support the healthcare policy for the political will, to gain the political will for the common man. But I'm happy to see people of elite staying together for the better cause in the name of blaming the doctors. Yes, there's a corruption. I have been running lab for the past 25 years. One of the first lab in South India to have so many things. But we are the only person who didn't give commission, and commission was introduced in this country, and without commission nobody can practice. No lab can thrive. And even then it's going on. But I accept the topic. But the topic must bring together the journalists and the public to bring quality products. Not only the doctors, everything. One small thing, three things I would like to say. The medicine is a dynamic, imperfect science. That's what he was telling. Number one. Another is, it is social infrastructure. You cannot expect return on investment. It is the people which gives the production. It goes with the public school education, results in the better economics. So people must join together to gain the political will to produce better medical personnel along with allied and supportive medical staff and pharmaceutical industry and diagnosis. One single thing I would like to ask every one of you, inclusive journalists. 2 years back, no, it's important thing. You when you introduced, you told one is questioning, another is suggestion. So we are nearing the end. So I pushed myself. I am asking you, every one of you.
You are lying in wait for this moment.
Yes. 2 years back, we had rain for 3 hours, three times, 25 days, and flood India, Chennai, Varda. And 1 week, almost all the places, no power. And there are so many medicines which are supposed to be kept in the fridge, cold storage, and stock in the warehouses. Do you have record? Is there any medicines were discarded? Were they were in cold storage really? Or those medicines which were supposed to be in the cold storage, inclusive vaccines, were they discarded or they were circulated among the people we have taken? So what I am trying to tell you,
yeah,
this
that's a good question. We'll end on that note. We must do some research on this.
Yeah.
Thank you. Thank you.
What we try to do is, let us rise to support for have a better healthcare.
Thank you. Thank you. Yes, the gentleman there has been having his hand up. Please introduce yourself.
I am Vishwanathan, editor, industrial
I
economist.
Yes, hello. I didn't see you. Yeah.
Thank you, Ram. I thought you were known as a leftist, but all the questions you are turning to the right. Anyway, thank you, Ram. Thank you for the chance. You see, I saw your comment on institutionalization of corruption. I'm more worried as a journalist about institutionalization of cartelization. I give a small example of what is happening, for example, in regard to hearing aids. I just tested with I'm 80 plus now, So I can talk with some experience of this thing, a little one. I want a solution from you people for this because it's a very serious issue of cartelization. You know, I had a fairly senior doctor recommend me to a hearing aid center in Kodambakam. We went there, they tested freely. It took quite some time. At the end of it, they said, very nice looking girls, they said about 55,000 for each year. Luckily for both my children from US were there by my side. They immediately took a photograph of it and checked with Amazon. It showed it as 18,500 rupees. The same brand, the price. So I took it up with the doctor and also with them again. What is the problem? They said this is the price. I took the name and the address of the person in Delhi. I checked with 5 different audiologists. They all said this is a practice, they can't do anything about it, it's a cartel. There are only 5 manufacturers across the world, 2 German, 1 Swiss, 1 American, 1 elsewhere. And they are all cartelized so beautifully, they are not able to reduce the price. They said, what will happen if I order for Amazon and take it? They said, nobody will attune it for your requirement. Can something be done about this?
Thank you. Would anyone like to answer that question? No, the activist has been waiting. Please introduce yourself, the activist. And that's the last question. You're too late. We'll see after he speaks.
Hello. Hello, sir, esteemed panel and everyone over here. My name is Chandra Mohan from Marapuri Hekam, a social activist, or otherwise known as an anti-national and urban Nexal. So, hi. Okay, so I do understand that there are a lot of doctors over here. One kind request to the doctors is this. When we are talking about these kind of issues, please don't get defensive. Don't get your knickers in a twist. We are not demonizing your entire profession. Introspection is the foundation of change. Please understand that. We do think of you like gods. So when there is an issue, when we are talking about it, please do not get defensive. We are not demonizing you. I just want to place that on record first. Now, since a lot have been talking about liver transplants and everything, the question that I want to ask is about accountability, but I want to come up with an example. I don't want to name the name of the hospital, but the hospital is supposed to give a liver to a particular patient. They pay the 25 lakhs full in amount, and in fact, that person is a doctor himself. But anyways, for about a year and a half, no transplant was done. And every month is, I don't know what the medical condition is. Probably you guys know about it. The stomach bloats are big. So every month they have to remove drain the liquid. And every month it costs about 80,000 for that person to do that procedure. So they literally kept him in cold storage for a year and a half, trying to extract as much money as they can. This is what the hospital was doing. Now that particular problem came to my attention, so I have to go and intervene. And what we found out is that he has a B positive, which is a very common blood group. And we took a sample of the list of people who were in the donors list and who were in the top. And he was actually in the top. And people after him were getting these organs and getting treated. So what we did during our research is we found that a lot of government hospitals where the patients are brain dead or those transplants are going to these private hospitals. Now these private hospitals pay a huge amount of bribe to the people in the government hospital to get priority over these organs. That is one thing that we also found during the investigation of this particular case. Now, after exhausting all kinds of solutions, finally I had no other option than to get the owner of the hospital, the number of the owner of the hospital, and then I had no other option than to threaten him. I threatened him saying that I will demolish your hospital's name from social media to everywhere else. I will bring in the media, I will bring in people, and we will picket in front of your hospital and demand justice till it gets done. Now he was giving me all kinds of excuse saying that, that liver is probably not fit for this patient, the blood group might not be sufficient or whatever, all kinds of reasons. But after all the threatening happened, within a week, voila, the operation is done. They found the donor somehow. Now the question is, who keeps these people responsible in your profession? Where is the accountability in this profession? If a doctor does a mistake, he screws things up, right? I understand they are not gods. Everybody can make mistakes. But the entire hospital comes in defense of the doctor. Doesn't matter whether he made a mistake or not, whether he killed a patient or not, The hospital comes in defense of the doctor. There is no accountability. Zilch, zero. It's not even like US. We can't even go to the courts to. And another question, one of the questions I can ask is, how many CEOs do I have to threaten to get things straightened out here? And one of the things is in government hospital, Stanley Hospital, a classic example of how bad the system is. One patient came for kidney dialysis over there, and he had hepatitis C virus in him. They didn't do the test properly. And even after that, one of the biggest things that they did is, problem that they did is this. The filters that they use in the dialysis, they reused it without properly sterilizing it. So that patient's hepatitis C virus got spread to about 20 other patients. And within a day, the nephrologist, the dean of nephrology, immediately sent all the patients out of the hospital and threatening them, telling them that if they even stand there, other patients will get hepatitis C virus. And these poor people, they don't know medical, even we don't know what science is. So this is what happened. So we have to go do investigative journalism literally inside the hospital, picket inside the hospital, and fight them. And of course, we went to the court, and in a record time, in 8 months, for all those 16 patients, we got the ruling in their favor, and 5 lakhs was given as interim compensation for them. But that is not enough. The question is about accountability. Why is there no accountability?
On that note, we'll stop. But what's your name?
Chandra Mohan.
Mr. Chandra Mohan, we invite you to write to the Hindu Center. We'd like to meet you to get more details, and then we'll process it and pass it on to those who can really look into this. But I thank you for this, these insights and information. But we'd like to be in touch on these issues. There's one. Dr. Nandi suggests there's one person here who can speak to this.
Dr. Amalur Pavanathan is head of, was excellent distributor of organs of brain-dead patients in Tamil Nadu and set the example for the whole country.
Thank
I'm
you,
an
sir.
admirer of this.
Thank you very much, sir. I just want to respond to you in a very, very simple way. I headed that department for 8 years. The 2 things worked well. One is we must ensure absolute transparency in organ distribution. We must know, the public have a right to know where each organ goes. This is tantamount, paramount importance, and that worked very well. Number 2 is constant interaction with stakeholders. This is a fast developing subject. We might also do mistakes. So the only way to reduce errors is a participatory democracy. You interact with stakeholders very frequently. So we used to have an advisory committee consisting of people like Karnakaran, and many ethicists and many journalists were also there. So advisory committee, participatory democracy, absolute transparency. They ensured a good working transplant system which became one of the best in the country. But having that said, whether that is scalable to the entire country, for example, MCI, I was thinking, what would be the good model of MCI we can have in this country? Why is that we are not able to have something like British Medical Council in India? What prevents us? And he was talking about medical research. But if your university's vice chancellors themselves are raided and they continue to be vice chancellors, and what kind of research you expect? So unless you tackle the problems at the top, unless you ensure a governance which is transparent, answerable to people, and participatory democracy is there at that level, I don't think you can tackle all these peripheral problems. Thank you.
So thank you very much. And I think on that note, it has to be inconclusive. But I think this has been a very good meeting for us, for everybody. I thank the panelists who represent some of the many contributors of this book. I thank Dr. Nandi especially for coming from Delhi. Dr. Mani has been here before in this auditorium. The Hindu launched or participated in the launch of his 2 of his books. Keshav has been very much with us, and Dr. Thomas is a new participant in this. We thank our panelists, and above all, we thank people. We were not surprised by the level of interest, but the fact that so many of you registered for invitations, some were invited, we really appreciate that, but I am not surprised because this subject is of great importance. they're closely connected to the lives of people. Some of you have experiences we can learn from, but I think this has been one of our best meetings in recent times. I won't bother to presume to conclude on any note. Please buy the book, read the book. You got a sense of the book. You got a sense of the differences in the book, some newly emergent here, which need to be followed up. This debate has to be continued, but I commend the editors of this book for getting so many people together to present a comprehensive view of what can only be called, that's a quote from the book, a broken system. Maybe not completely broken, but a broken system nevertheless. Few can dispute that. And I think and the question is, what do we do about it? So thank you.